Everyone, welcome back to Sums Up. I am here with a new video on Alzheimer disease. So before beginning, I am gonna tell you that I made a separate video of dementia in which I discuss all the types of dementias and how to differentiate between each type of dementia. I haven't discussed any kind of detail of any type of dementia in that video. I would put the link in description of that video. It is only to differentiate between different types of dementias, and now I'm gonna discuss all different types of dementias in their separate videos, and today I'm gonna begin with Alzheimer's disease. So it's gonna be a short video and covering all the important stuffs of Alzheimer disease. So what is Alzheimer disease? It is the most common cause of dementia, which is progressive neurodegenerative disorder. It mainly affects memory, learning, and behavior. It causes loss of learned motor skills and language, changes in behavior and personality. Patients become mute and bedridden. Infection is a common cause of death. Infection is a common cause of death in Alzheimer's disease. Usually occurs in elderly patients, begins slowly and worsens over time. So the recognition clue for Alzheimer would mostly be old patient with progressive memory loss. It's Alzheimer's. Talking on pathology, so the main problem is loss of cholinergic neurons, which causes decreased acetylcholine in nucleus specialis of manates. This causes Alzheimer disease. Two major findings which we find in Alzheimer is beta amyloid plaques and neurofibrillary tangles, which are also called as tau proteins. Recognition clue: plaques plus tangles plus memory loss. It's Alzheimer disease. So there are genetics and risk factor for Alzheimer disease. Most commonly, Alzheimer is a sporadic disorder, which means that it occurs randomly in any patient. The most important risk factor for Alzheimer is increasing age, which is biggest risk factor for Alzheimer's. Like every 5 years after the age of 60 doubles chances of Alzheimer disease. ApoE4 increases the risk. ApoE2 is a protective for Alzheimer disease. ApoE2 is protective, ApoE4 increases. Remember these associations. Then there is, these are sporadic causes. Then there are certain things which increases chances in younger patients of Alzheimer's. There are autosomal dominant mutations in APP gene. What is APP genes? It is amyloid precursor protein which is located on chromosome 21. So Down syndrome, in which we have three 21 chromosomes. In that, APP is increased and it can increase chances of Alzheimer in younger individuals. So the second thing, presenilin and presenilin 2, 1 and 2, this both also increases early familial onset Alzheimer's. So coming on clinical features, it's there are early symptoms and there are late symptoms. Early symptom is short-term memory loss, forgetting names, repeating questions. Later symptoms are personality changes, confusion, difficulty speaking, and loss of daily functioning. Now, remember, if there are personality changes first, like in first we see personality changes, then it's frontotemporal dementia, not Alzheimer's. But if short-term memory loss over a longer period of time progresses to personality changes, then it's Alzheimer's disease. So coming on next, brain findings, gross brain changes on MRI is cortical atrophy and enlarged ventricles. Areas commonly affected: hippocampus and temporal lobe. Recognition clue: always remember, whenever hippocampal atrophy occurs, memory problems. There are memory problems. Coming on next, histology and high yield microscopic findings is beta amyloid plaque outside neurons and tau tangles inside neurons. Beta amyloid plaques arises from amyloid precursor proteins which is coded on chromosome 21. Amyloid precursor protein normally undergo alpha cleavage. Beta cleavage results in A beta amyloid. Amyloid also deposits around vessels, increasing the risk of hemorrhage. And tau tangles, these are microtubules associated proteins, and they are located inside neurons. Special terms: Congo red staining, amyloid angiopathy may occur. This is all high yield buzzwords for Alzheimer disease. How to diagnose it? Diagnosis is mainly clinical. Supportive tests are MRI brain and cognitive assessments. MRI may show hippocampal atrophy, cortical shrinkage. Important definitive diagnosis is brain biopsy. Remember, always definitive diagnosis for Alzheimer is brain biopsy and autopsies. Coming on next, we have treatment. Remember that what was the problem? It was decrease in acetylcholine. So the main thing we are gonna do is increase in acetylcholine so that the imbalance can be balanced. So the main drugs for treatment of Alzheimer's are donepezils, rivastigmine, and glantamine. These all increase acetylcholine. Severe diseases, we can also use mentine, which is an NMDA receptor antagonist. Recognition clue cholinesterase inhibitors are treatment for Alzheimer's. So this is ultra high recognition summary for Alzheimer's. Whenever you see elderly patient, progressive memory loss, hippocampal atrophy, beta amyloid plaques, dot angles, decreased acetylcholine, ApoE4 association, and Down syndrome association, it is always Alzheimer disease. So remember this, all these terms written over this page. This is gonna make you choose between the options in your exams. Sometimes there is not given straight away the answer, like the above statement is about Alzheimer's. You know Alzheimer's, but you don't know that the problem, it can be hippocampal atrophy in the options. The question may be asking what is beta amyloid plaque in it, dot angles. So just remember these things so that you know whenever Alzheimer's come into your question, how to actually deal with it. So for today it's enough. Thank you, and like my video if you like it while watching. Subscribe me, share and enjoy. Don't forget to enjoy.